Hey everybody, thanks for tuning in to another episode of our weekly live stream. My name is Duke and I'm with LPT Medical. Today we're going to be talking a little bit about the COPD treatment team, who it comprises, or who makes that team up and why it's so important. And then I also wanted to talk to you guys about a new partnership that we formed with another company. I'll save that one for a little bit later. It all ties in together and I think you guys are really going to enjoy it. I know we've talked about this topic a couple times, but you really can't get enough information on this, and I can't stress the importance of how much a care team can really impact your ability to manage your symptoms, feel good about yourself, and really follow your treatment plan exactly as you should. So to start, let's just go over who's in your actual care team. It's going to start with your primary care physician, the person that you see for almost anything, whether you have a cold, you need to get blood work done, whatever it might be. The primary care physician is going to be the first person that you see in your care team. The second one is going to be a pulmonologist. Obviously, a pulmonologist, if you're living with a respiratory disease, you've more than likely been referred to the pulmonologist. Number 3, a respiratory therapist. Number 4, a dietitian or a nutritionist. Number 5, a fitness trainer. Number 6, a therapist or a counselor. And number 7, friends or a personal support system. So those seven different roles all complete your COPD or your respiratory care team. Like I mentioned, your primary care doctor, he or she is a very important member of your COPD treatment team. They'll usually provide most of your care during the early stages of the disease, and your primary care doctor will also assess how advanced your disease actually is, and they're likely going to refer you onto somebody for more specialized care, and that person that they would refer you to is typically the pulmonologist. A pulmonologist is a doctor who has special skills to treat people with lung diseases. Sometimes pulmonologists are not needed until a person's disease has progressed to a later stage, but this decision can be made between the COPD patient and your primary care physician. The pulmonologist is able to carry out special tests to get more information about your COPD and your respiratory disease to suggest better treatment for your symptoms. So right there, you can see a distinct difference between your primary care doctor and the pulmonologist. The pulmonologist is going to specialize and give you specialized treatment and care to help you better manage your disease and give you the best treatment for your symptoms. One thing that we didn't mention as far as the COPD treatment team would be a COPD treatment plan. It's not really a team member per se, but it has just as much importance as your primary care doctor or your pulmonologist, because you're going to be using your COPD treatment plan to not only monitor your symptoms and record your medication, or basically have a medication log or medication diary, but the COPD treatment plan is basically going to have everything that you need to know, all right, what kind of decisions do I need to make? So with the COPD treatment plan, you typically have 3 different areas. You have green, yellow, and red. As is with most cases, green means that you're good to go. You're having low symptom severity, it's manageable, your breathlessness is manageable, you're feeling down, it's just a normal day. Yellow is kind of where things can get a little foggy. You might be having a hard time breathing. Your mucus production might be increased, whatever it might be. Red is when your symptom severity is extremely bad. You're having a really hard time catching your breath. And red is the area where you're going to want to go to the ER and make sure that you get medical attention immediately. Yellow, you might want to contact your primary care doctor or your or your pulmonologist. That way you can discuss what's going on and you guys can both get together to determine what the next best step would be. But along with that, in the COPD treatment plan, you're also going to have things that make up like pulmonary rehab, lifestyle changes, medications to help you breathe better, and oxygen therapy. So not only do you have a COPD action plan with that treatment plan, but you're also going to be going through and learning how to be self-sufficient for a lack of a better term. So with pulmonary rehab, you're going to be speaking with a respiratory therapist. You're probably going to be speaking with a dietitian or nutritionist, and you're probably going to be working with a fitness trainer. All those three things can be built into pulmonary rehab, and that's why pulmonary rehab is honestly one of the most effective, if not the most effective way to treat a respiratory disease, because not only do you get the treatment and the knowledge from the healthcare professionals, but you're also having somebody hold your hand and walk you through it so you know what to look for and you know how to do this stuff at home. And then obvious lifestyle changes that you'll see, quitting smoking, improving your diet, starting an exercise routine, and getting that emotional support that you really need. It sounds like it's not going to be that effective as far compared to medications and pulmonary rehab, but the emotional support is such an undervalued factor when it comes to treating your disease. If you just have somebody that you can talk to, that you can relate to, somebody who might have already been through this, I mean, it can make coping with the disease and the lifestyle changes that much easier. So let's get back to the care team. Respiratory therapist is next on the list. Respiratory therapists are there to help teach the patient about their disease, whether it's COPD, cystic fibrosis, pulmonary hypertension. Patients, you need to know how your disease affects your lungs and the rest of your body. So respiratory therapists are going to help you, educate you on this, and they're also going to provide support and guidance about many other parts of your COPD treatment plan, including understanding COPD medications and how to take them correctly. That is something that we have talked about on our live streams continuously, and we will continue to do so. The reason being, you want to take your medication exactly as it's prescribed. So if you need to take it twice a day with food, you want to make sure that you're taking it twice a day with food at the same time each day. That's going to make the medicine more effective for you, and it's going to make it more effective to manage your symptoms. Respiratory therapists are also going to be giving you advice and support about how to quit smoking for good. So if you haven't quit smoking, a respiratory therapist and pulmonary rehab, they're going to be there to support you emotionally. They're going to give you the tips and the tools that might be the end-all be-all to help you finally quit successfully for good. And I've said it a million times, and I'll say it a million more. If you have been diagnosed with a respiratory disease and you're still smoking, that needs to be your number one priority. By quitting smoking, you can slow the progression of your disease, improve your symptom severity, and it's going to be better for your overall health. And if you haven't been diagnosed with a respiratory disease and you're still smoking, please, please, please quit as soon as you can. The sooner you can quit, the better. We've talked about the timeline of what happens to your body when you quit smoking, and the health effects kick in almost immediately. We're talking 5 minutes, 10 minutes, 15 minutes after you put that cigarette down and you quit for good, you start seeing some health benefits. So we cannot stress the importance enough about that. Respiratory therapists are also going to be giving you advice and tips on how to avoid infections, whether that means staying current with your vaccinations for influenza and pneumonia, avoiding large crowds during cold and flu season, whatever it might be. They're going to do whatever they can to help you avoid infections, because as we all know, when you have an infection, when you're living with a respiratory disease, it can compound the symptoms and the effects and lead to a hospitalization or even an exacerbation of your symptoms. This one's a really big one. Respiratory therapists are going to help you learn how to use oxygen safely and how to use it properly. So when it comes to oxygen safety, oxygen concentrators, because they don't have compressed gas or liquid oxygen in them, they're much safer than a tank or a liquid oxygen. However, there are some people who simply can't use a portable concentrator because their flow rate doesn't meet what the concentrator can provide, or they prefer the tank over the concentrator, whatever it might be. But they're going to give you tips to help you use your oxygen safely. And just a few off the top of my head, whether you're using an oxygen tank or a concentrator or liquid oxygen, all of these come into play. So for example, if you're driving in the car You want to drive with the car, you want to drive with your window cracked down, that in case there's a leak of oxygen, anything like that, so it can properly ventilate your car, and something as simple as like a little static electricity won't spark anything. Another one would be how to store your concentrator or your tanks, whether you're driving or just storing them at home. You're going to want to store them in a climate controlled area. As far as oxygen tanks and liquid oxygen go, you want to store them standing upright so they aren't leaning or tilted. So that way it prevents, it lowers the risk of having them leak. Those are just a few things. Again, if you're traveling in the car, you don't want to store your oxygen tanks in the trunk of the car. You want to keep them upright in the back seat. That way, if something happens and you were to get rear-ended, you have a little bit of a buffer and they're not tilted over, preventing them from leaking. Again, that was just 3 really quick tips. Your respiratory specialist is going to have a few more for you. And again, if you want more tips, go ahead and head to our blog, blog.lptmedical.com. You'll find as much information as you want about oxygen safety, treating your respiratory disease, all that good stuff. Another thing respiratory therapists are going to do is they're going to give you advice on how to improve your breathing. Not only are they going to give you advice, but they're going to show you exactly how to do the breathing exercises that we talk about on our live streams. The pursed lip breathing, the diaphragmatic breathing, deep belly breathing. They're going to do whatever they can to teach you how to do all these breathing techniques. So they're going to help you, number one, catch your breath when you feel short of breath. They're going to help you fully expel all of the air out of your lungs, because as I've mentioned before, that breathlessness, a lot of times it doesn't come from the act of breathing or the act of not getting enough air. It usually has to do with not getting that air out of those deep pockets in your lungs. So respiratory therapists are going to be great about showing you how to improve your breathing. And then this one's a big one. They're going to teach you how to deal with a COPD exacerbation. As we've mentioned on this live stream many times before, COPD exacerbations are typically the #1 leading cause for hospitalizations and readmissions. An exacerbation is simply put a flare-up of your symptom severity. So your coughing, your breathlessness, your mucus production, they can all increase. Some of the warning signs would be your mucus gets thicker and changes in color to a more greenish color. Your shortness of breath, you just simply can't catch your breath. All of these things are warning signs of a COPD exacerbation. And your respiratory therapist is going to help you not only identify your triggers, but teach you what to do in the event of an exacerbation. Next on the list, we have the nutritionist and dietitian. Again, another thing that we've harped on our live streams countless times is the importance of diet and nutrition for treating your respiratory disease. There are countless benefits, and I'm talking by making subtle changes to your diet, whether it's finding out what one of your triggers is. Let's say broccoli, because broccoli is a cruciferous vegetable, and a cruciferous vegetable is known to cause people to get bloated and cause gas in some people. It's all a person by person basis. So once you identify your trigger, if you realize that broccoli is one of your triggers and it really makes it uncomfortable and harder for you to breathe after you eat it, you can make simple changes, cut that out of your diet, replace it with something else, and you're going to alleviate that breathlessness and that uncomfortable feeling. And you can do this time and time again with each one of the triggers that you find. Now, the nutritionist and the dietitian are going to help you find the healthier alternatives. They're going to help you find ways to incorporate a different eating schedule into your everyday life. We're used to eating 3 large meals a day with a couple snacks in between. But when you're living with a respiratory disease like COPD, when you have 3 large meals, instead of spreading them out and doing 5 to 6 small meals a day, those 3 large meals can, number one, make you feel fatigued, tired, and lethargic. Number two, they can cause discomfort while digesting your food, and they can put pressure on your diaphragm, which in turn makes it more difficult for you to breathe. So the dietitian and the nutritionist, they will help you come up with a way to eat 5 to 6 smaller meals a day that are going to be healthier for you. And on top of that, they're going to give you more energy. You're going to feel great throughout the day. You're not going to have that 2 p.m. burnout where you feel like you need to take a nap every day. And one of the things that comes with COPD is maintaining a healthy weight. There are some people who they have a really hard time maintaining weight and keeping weight on, because when you're living with a respiratory disease, simply breathing can take as many as 10 times more calories than a healthy person. So right there, if you're burning 10 times more calories and you're having a hard time putting on weight and keeping and maintaining a healthy weight, then the dietitian and the nutritionist are going to help you come up with a way to not only make it enjoyable, but make it easier for you to maintain that weight. On the flip side of that, if you have a hard time losing weight, the dietitian and the nutritionist, they're going to do the exact same. They're going to come up with a plan and a meal plan that's going to help you lose weight while also having energy throughout the day and eating stuff that's not going to really do any harm to your breathing or put any pressure on your diaphragm. Up next, we have the fitness trainer. Again, the importance of exercise while you're living with a respiratory disease is almost unparalleled. It can seem counterintuitive. You're already having a hard time breathing. Why would you want to put stress on your lungs? But it is the exact opposite. And for those of you who are newly diagnosed or you haven't really done any exercise in the recent future, we don't mean you're going out there and walking a mile right off the bat, or you're getting into jogging or lifting weights. We're simply talking, if you want to walk, you can walk outside for 15 minutes, or you can walk for as long as you can, take a break, walk back, and then you have a benchmark to start. So if you're able to walk for 5 minutes straight, then you needed a break and you went back home, the next day you can try and push it to 5 minutes and 30 seconds, 6 minutes, 7 minutes. So you're progressing. You're not just going in and overdoing it, because you don't want to overdo it and potentially hurt yourself, or potentially scare yourself away from something that is so beneficial. And then it's not just walking and aerobic exercises. You can also do chair exercises. I know your fitness trainer is going to go through all of this with you. But if you're at home and you need help, YouTube is a great resource for you to use at your disposal. You can pretty much find any kind of workouts for seniors, for people with COPD, chair exercises. Those are all available there. But by getting a fitness trainer that's going to be part of your care team, you're going to be able to manage your symptoms better and improve your quality of life. And there's no questions about that. Fitness is easily at the top of the list, right there with diet and treatment adherence. Next one, this one doesn't really get talked about a lot. A therapist or a counselor can have a huge significant impact on your ability to treat your disease, keep your symptoms in check, all that good stuff. So one of the things that's common, mental illnesses or mental health is a huge thing. So when you're living with a respiratory disease, depression and anxiety can both be very common. They're comorbid. I mean, you just got diagnosed with a respiratory disease. You're being asked to make all these significant lifestyle changes. You feel like life as you know it is over. It's very doom and gloom, but it doesn't have to be that way. And there are a lot of people who are living a great life with their respiratory disease. And a lot of it can come from the emotional support that they're getting from a therapist or a counselor. So therapists and counselors are going to be able to help you treat and manage the symptoms of your anxiety and depression naturally, and possibly with medications and prescription medications. This might include individual or family therapy, or helping you with finding and setting up a support group for people living with COPD. Some COPD patients with anxiety and depression might need medicine to help treat those conditions. In those cases, like I mentioned, the therapist or counselor can refer you to a doctor, or if it's a psychiatrist, they'll be able to prescribe them themselves. Next up, social support. With the social support aspect, this goes a long way along with the therapist and counselor. The social support, studies have actually shown that patients with any condition that maintain close social ties are more likely to follow their medication regimen, eat better, exercise regularly, and have better health outcomes. So if you live in a rural area, maybe like in the eastern plains of Colorado or anything like that, Kansas, Nebraska, Oklahoma, Texas, I know every state has rural areas, but if you're living in a rural area, it can be a lot harder to find a support group and get that emotional support that you're really looking for. So going online and finding a support group, whether it's on Facebook, I know the COPD Foundation has a great forum that you can go and speak with other people. But if you can find somebody who's been in your position, ask them questions, ask how they came out on top and how they overcame this adversity. It can really go a long way and make it easier for you. So that's why social support is such a big aspect and part of your COPD care team. Now, with all that being said, not everybody is going to have access to all this stuff. I know I mentioned the rural areas. It can be really, really hard to find somewhere close to home that you're going to be able to get access to all this stuff. It's a pain point that I've heard all 8 years of me being in this industry is people not having access to it. And with the advancement with technology, there's no reason that people shouldn't have the ability to connect with every single kind of person on this care team list and get the treatment that they need. So as you know, so that's why we've teamed up with this amazing company called Thrive eLearning. As you know, if you've tuned into any of our live streams or if you've watched any of our blog, if you've read any of our blog posts, we are very, very passionate about patient education. We want to do everything that we can to help patients continue to enjoy their independence. We try to help patients find a way to afford their oxygen machines they need, and we try to provide all the information we can about disease management. After watching our videos and reading our blogs, we've heard time and time again from patient after patient that after suffering with COPD and other respiratory diseases for years, that no one has ever told them some of the information that's on our blogs. We know not everyone has access to the ideal care team, and either for financial reasons or they may live in areas where these services are not available. So those are two big pain points why people can't get access to the treatment that they need and the treatment that they deserve. This is exactly why we partnered with an organization called Thrive eLearning to provide an all-encompassing care plan as well as access to a top-notch care team. Your primary care doctor and your pulmonologist, you need to see them in person as numerous in-office tests are required. But other members of the care team, those can be consulted via phone or video conference. So with Thrive members have a lifetime access to a library of online courses that include video instruction as well as downloadable information. The course was put together by a team of respiratory experts and cover all the necessary skills you need to slow the disease progression as well as properly manage your symptoms. You'll also have access to one-on-one counseling with a registered respiratory therapist, a certified nutritionist, and a certified wellness counselor. Everything except for your primary care doctor and your pulmonologist, you will be able to find inside this Thrive eLearning. We are so excited about the partnership. I can't express my excitement enough. We can't wait to team up and see how much good it does for everybody living with respiratory disease who are having a hard time getting the care that they need from their care team. With that being said, that kind of concludes our episode for today. Do we have any questions, Lisa? Thank you very much for tuning in. I really, really appreciate it. I'm sorry for all the noise in the background. With that being said, if you have any questions while you're watching this and it's not being recorded live, please feel free to leave a question down below in the comments. You can head over to our private Facebook group, LPT Medical Support Group. You can go there. We'll have a bunch of information on Thrive eLearning posted at the top there for you to learn more about Thrive and what they're all about. Again, I'm so excited about this partnership because I want to help as many people as I possibly can. Now on to finish the video, I wanted to remind everybody that Monday was Cyber Monday. We had an insane Cyber Monday sale, and the response was absolutely incredible. Our phones were ringing off the hook on Monday. They were ringing off the hook after hours, and because we couldn't get to everybody, we're extending our Cyber Monday sale through the end of the week. So Friday at 5 p.m. Mountain Standard Time or while supplies last. With our Cyber Monday sale, you're going to be able to get a brand new Inogen 1G5, Normally that retails for $2,995, but you're going to be able to get it for $1,895, and that's going to come with all the accessories, one battery, AC and DC power supply so you can charge it at home and in the car. It's going to come with a custom carrying case with the shoulder strap, tubing, filters, a manual, and it comes with a full 3-year warranty. Again, we're running that until the end of the week or while supplies last. So if you are trying to save $1,100 on the Inogen 1 G5, give us a call at 1-800-946-1201. Thank you very much for tuning in. I appreciate it. I will see you all next week.